Omicron, it has been spreading like wildfire around the country, causing a spike in hospitalizations, but with less severity than what we've seen early on in the pandemic. Well, joining us with more on what we need to know is Dr. Robert Oliverio, Chief Medical Officer for Roper St. Francis Healthcare. It's great to have you.
Thank you.
I've got about a million questions for you. First things first, let's start with Omicron. What is this?
Omicron is a variant of the virus, the COVID virus that we've been dealing with for the past, over 2 years now. And it's a variant that has changed enough that it's done a couple of things. It's made it much, much more transmissible. It's made it much more easy to break through the defenses that are either given to us by previous infection or, vaccinations. So it's done a couple of things. It's also made it less severe. So every time a variant comes about, there are different characteristics to this variant. So Omicron is very different from what we've seen in the past.
Indeed. And can you talk about some of the common symptoms that people see when they may have Omicron or when they do have Omicron?
It's like a good old-fashioned cold, mostly like a headache, nasal congestion, often starting with a scratchy throat, cough, and that cough can be a little bit productive, fever, and then, things that you don't want to necessarily see, but can happen are things like shortness of breath, nausea, vomiting, severe muscle aches, and commonly severe fatigue. So people feel really tired. It's like a bad cold.
When do we start seeing this in South Carolina?
Gosh, it was right before Christmas. It started coming on about a week or so before Christmas when we started really talking about it. I think mid-December we were talking about it in South Africa, and then within about 2 weeks' time or a little less, we started seeing it in South Carolina.
I know so many people. There are so many people in my life who have caught it. Why are we seeing such a huge surge right now? Is it because of the transmissibility, or does it have anything to do with the holidays and people gathering together?
Simple answer, yes. So it's more transmissible. And and if it's transmissible and we get a lot of people into a closed room, the likelihood is if COVID's there, if the Omicron variant is there, you're going to go home with it. And really the question is, how bad is it going to be? Yeah.
In your opinion, how have people been as far as wearing masks? Are you finding them that they've gotten a little bit lax recently because the Delta variant kind of came and sort of went, and then now we're dealing with Omicron, which has less severe symptoms, but are we being less proactive, I should say, about protecting ourselves?
Well, I can, my own experience, I see people now wearing masks more frequently. There was a period of time, once, October rolled around into, November, masks were sort of going away. It wasn't, we weren't seeing as many cases. The rate of infection in this area was low. It was on the order of, 4%. And, we were sort of getting lax. And then Omicron came on, and we didn't catch up as fast as Omicron caught us. And so I think now people are getting more alert to what's going on, how transmissible this is, and I've seen mask wearing increase just in public.
I have as well, actually, in recent days, I would say within the last week. And as far as the fully vaxxed and the boosted, we're seeing those people catching it. So why are those 3 shots or 2 shots, as it were, not enough of a prophylactic against Omicron?
Yeah, well, again, it's like seat belts, and I use this analogy a lot. A seat belt will not protect you from getting into an accident. A vaccine will not protect you from getting exposed to COVID. It really protects you from getting really hurt by COVID. And so, you may come away with a cold. And, if that's what you got, we get colds all the time. And it doesn't, cause people in trouble. The thing about vaccines is you want to keep transmission down. So if you can stop transmission, that helps a lot.
Absolutely.
But Omicron is so virulent that it can be transmitted. So that's one of the problems with Omicron.
I see.
But the vaccines work. They keep you out of the hospital.
Right. All right. We need to take a break here. When we come back, I do want to talk further about what's to be expected down the road. So let's do that in just 2 minutes. Don't go anywhere. Welcome back. We've been chatting with Dr. Robert Oliverio, Chief Medical Officer for Rupert St. Francis Healthcare. We've been talking about the Omicron variant and how very transmissible it has been, how we've seen a huge spike since the holidays in folks catching it, even though they have been vaccinated, boosted, you name it, or have had COVID prior. So we're not seeing those antibodies working against this particular variant. But what I do want to ask you, Doctor, is they say, and maybe you can offer some clarification on this, but as quickly as those numbers have climbed, they say they should decline just as fast. Is this true?
That's our hope. And so we're still, I think, in the upswing right now. We're close to 50% of the tests that we do in our system are positive for COVID. And so, compare that to 4% of the tests that we did, just maybe a month ago.
Right.
And so we are seeing a considerable increase still. But, when it goes that fast through the community, it basically burns itself out. So a fast rise, you would expect to see a fast drop off.
Right.
And that's what we're hoping.
And we're already seeing in South Africa, where it originated, we're seeing those numbers starting to decline already. So that gives us some indication as to what to be expected here in the United States. In terms of getting tested, so if you do exhibit any of these symptoms, is it just recommended that you go out and get a test?
Yes. Basically, that's really what you want to know is number one, if you're feeling sick, you want to know if you have COVID or not, because that really, informs what you're going to do for the next 5 to 10 days. And so, get yourself tested. And then, use medical advice to help you navigate what needs to be done after that.
And if you haven't been tested, so you don't know what your diagnosis is, if you are exhibiting those symptoms, what do you recommend people do and not do?
Right now, if you get symptoms of a cold, assume you have Omicron. It's that prevalent in the community.
Yeah.
We're not seeing a lot of flu. And so, the likelihood is you've probably caught, Omicron. Now, good news is it's probably going to be relatively mild, particularly if you've been vaccinated and boosted. But, then you're transmissible. And, it can be really transmissible the first couple of days before you exhibit symptoms and the couple of days after you exhibit symptoms. So really what we're telling folks is, if you feel that way until you know, or even if you do know, you really should isolate. You don't want to be around other people. You don't want to give to others.
And if you have tested positive, you quarantine for a couple of days, you test negative, is it safe to then go back out into the world?
The way we're approaching this, and this is, based on the CDC guidance, given the fact that, people tend to sort of clear this virus faster than what we had previously cleared COVID, if you're getting better, say, if you have symptoms on day 1 and you've gone through 5 days and you're getting better and you have no fever for, 2 days prior to day 5 or 6, at day 6, so 1, 2, 3, 4, 5, those 5 days you're out of commission, on day 6, you can actually, with a mask, go back out. As long as you're feeling better, you're not sneezing and coughing all over the place, and you don't have a fever, and you're not using, Tylenol or ibuprofen to keep your fever down.
Okay.
That's what we're telling folks now.
And 2 final questions for you. So we know now that each shot, so if you get the 2 shots plus the booster, it's the same shot. So basically each one is prolonging the protection. Since we do get that booster 6 months after our last shot, are we looking at a future of getting a shot every 6 months against this?
Well, just to be clear, the CDC has recommended shortening that booster interval. So, after your first, series of shots, your 1 or 2 shots, depending on what kind of vaccine you get. Now at 5 months, you should probably get a booster shot. So
5
they've
months.
actually shortened it 1 month just because of how transmissible this is.
Right.
But the likelihood is this virus is going to continue to change, and we will find more variants coming through. Some of those variants will just go away because they're not going to infect us. But some of them may be different enough that they can infect us. They can evade our immune response, and at that point, we'll be back to do we give a booster shot? Do we alter the vaccine to cover these new variants? I mean,
Sure.
these are all questions that remain to be answered. I just don't know.
And this segues into my last question, just real quick. If you can tell me what is next? Are we looking at another variant down the road?
Until we have sufficient numbers of folks that are really, vaccinated, boosted, the likelihood is this virus is going to continue to infect people and change over time.
Okay.
So, we're probably going to see. I mean, we've seen more variants.
We
even
have
since Omicron.
Indeed, we have Delta, Omicron. Let's hope whatever is in the future is not as bad as what it's been. I want to thank you so much, Dr. Oliverio, for joining us.
Thanks for having me.
We're back after this.